So for life alerts, this is going to be indicated for patients who need to increase active range of motion, particularly internal rotation of the hip. And this can be prescribed with a baseline of just 3 sets of 10, which can be adjusted based off the needs of the patient. For progression, this should be progressed moving into resistive range of motion, not necessarily in this motion, but just progressing to the strengthening side of rehab. And this should regression should occur if pain is stated by the athlete, if they feel pain with this movement, or if they are not able to have quality range of motion with this movement, such as if the contralateral hip is starting to rise and they're not able to drive the hips down into the floor or the table. And this should be discontinued or progressed. This should be discontinued if, just as I mentioned, if they do feel pain during this movement or they're not able to achieve that quality range of motion. And this should be progressed to going into the resistive range of motion. And this is just an example of the life alert. And one thing to note is just wanting to keep that hip down for the movement. You don't want to see that hip rise when they're coming back down. Wanting to focus on that, on driving the hip into the floor or the table.